If the neck rotation is limited or you've got pain in the neck and you've also got arm or hand pain or sort of tingling or irritation along the forearm or the hand, then the two can be linked because the nerves that run from the neck go all the way down to the fingertips. If there's any irritation in the neck or the structures are slightly tighter, it can impinge and irritate the nerves and cause odd sensations running down to the hands. I'm going to go through 2 different neck exercises in order to loosen and free the neck up to reduce any restriction or impingement on the nerves, and also go through 3 really specific nerve stretches in order to increase the amount of range that you've got in the nerves, because nerves generally tend to love to move. So if you're moving the nerves, then the nervous system perceives less of a threat and the pain generally tends to simmer down and lessen. So the first exercise we're going to go through is really good at increasing the amount of movement that you've got of the neck into rotation, and it's called a snag, so a sustained natural apophyseal glide. All we're going to do is grab a towel, roll it up, pop it around your neck and increase equal traction on either side, so just a gentle pull. Then all we're going to do is rotate the neck to one side, bring it back, and then again pull on the other side of the towel and rotate in the opposite direction. And you want to repeat this through 10 to 15 times on either side, and you should by the end feel that the amount of rotation in the neck is slightly more. Again, with this exercise you don't want to go into pain, so gently move into the area that you start to feel the pain and then ease off. Because if you're constantly going into pain, you're only going to irritate the neck further. This exercise is really good because you can isolate different sections of the neck. So the first 3 joints of the neck, C1, C2 and C3, tend to control the first 30 degrees of rotation. So if you find that this is a restriction, keep the towel really nice and high on your neck. If you find that it's towards the end of the rotation, then it's generally C4, C5 and C6. So you put the towel ever so slightly lower down and then rotate in either side and see if this makes a difference. So the next exercise we're going to go through is functional rotation of the neck, and it's a really effective exercise and you don't need any equipment. All you're going to do is look down and create a bit of traction in the neck. When you create the traction, you want to walk past and keep your eyes directly on that point, so the whole body is moving but the neck isn't, and it just works into the individual joints of the neck just to help free it up. And you can change the angle, so if you're looking up and walking past, you're working slightly lower down. If you look down and walk past, and you're working slightly further up the neck. So again, depending on the area of restriction, if it's towards the end, you want to look up and walk past. If it's higher up, then you want to look down and walk past something. I'll record a video of me doing it so you know what I'm talking about. So here, I'm going to pick a position on the floor, turn the head, look down, and then just walk past it. So this exercise is a really good stretch to work into the median nerve. The nerves generally tend to love to move, so if you're really quite tight and protecting them, it's just going to irritate them even further as soon as you move out of range. So if you ease into them, working on your breathing, then it tends to reduce the amount of stress on your nervous system and again reduce the amount of pain that you're experiencing. So with the hand on the wall into extension, you should feel like a slight pins and needle feeling on the forearm. If you twist the whole body away, tilt the head, this is going to increase the sensation. So you want to gently work into the area that you feel the restriction. So for me it's here and then out, in, out. And it's really not a no pain, no gain scenario. So if you're really aggressively stretching it, you're just going to make it worse. So bit by bit, day by day, repeat through 3 here and there until you total 15 to 20 stretches. And you should gently, by the end of 4 or 5 days to a week, feel that there's a reduction in the pain and symptoms. The next one that we're going to go through is the ulnar nerve stretch. So with your hands, just like so, depress the shoulders, so really drop them down, and then bring them up towards your eyes, and then back down. And then again, depress the shoulders, bring the fingers up to the eyes, and then back down. And you should feel that stretching along the funny bone, so that ulnar nerve. Final exercise we're going to go through is the radial nerve stretch, and people generally don't tend to have too much irritation along this nerve pathway, but I'll show you anyway just in case you do. And again, with all of these stretches you can compare one side to the other side and see if there's a difference between the two. So this is the radial nerve stretch. So what you want to do is rotate the hand out, drop the shoulder, just because if the shoulder's slightly further up and tight, then the nerves are going to be shortened. So really lengthen the nerves so you're getting a nice stretch. Rotate the hand out, and you should already feel the stretch along the inside of the forearm. Then drop the head to the side and move the arm out. For me, I can really feel this stretch already. Then you want to move the head back and out. So when you lift the head back, there's less stretch on the nerves and the symptoms in the forearm should reduce down. You can also move the arm in and out. And again, this is going to ease into pain and then out of pain. And in summary, the exercises that we've worked on are snag, so rotating the neck either side, just to reduce the amount of tension you've got in the area and to free up the rotation. Next, functional rotation, so creating tension in the neck, walking to and from, so you're creating rotation in the neck as well as moving the body. Then we've worked on the 3 different nerves, so the radial nerve, the median nerve and the ulnar nerve, and gently moved the area and flossed in and out of restriction. Thanks again for watching, and I hope that's given you a little bit more insight as to why your neck and your arm might be hurting. Give me a comment below if there's anything that you're stuck on or you need a little bit more clarity on that, and I'll be really happy to help.